Can a plant-derived supplement like berberine affect blood pressure? Here's what the evidence actually shows. This video is for general information only and is not a substitute for advice from your GP or pharmacist. We don't provide dosing advice, and nothing here should replace your prescribed treatment. High blood pressure affects millions of people in the UK, and many are looking beyond conventional medication for additional support. Berberine is one supplement that's been generating a lot of interest. So let's look at what the science says. Berberine is a naturally occurring compound found in plants like barberry and golden seal. It has a long history of use in traditional Chinese and Ayurvedic medicine, and it's now widely available in the UK as a food supplement. It is not a licensed medicine. So how might it work? Research suggests berberine activates an enzyme called AMPK, sometimes described as the body's metabolic master switch. When activated, it may influence glucose metabolism, lipid regulation, and energy production. Some studies also suggest berberine could promote the release of nitric oxide and improve the function of blood vessel walls, both of which may play a role in blood pressure regulation. There's also early research pointing to possible effects on gut microbiome composition and inflammation, though the clinical significance of these findings in humans still needs a lot more investigation. When it comes to blood pressure specifically, emerging research suggests berberine may produce modest reductions. However, the evidence quality varies considerably, and this is really important. UK clinical guidelines do not currently recommend berberine for managing hypertension. It is not a replacement for prescribed treatment, and you should never stop or change your prescribed medicines without speaking to your clinician first. Now, if you're already taking medication for blood pressure, pay close attention here. Berberine may have additive blood pressure lowering effects when combined with antihypertensive medicines. That might sound like a good thing, but it can actually cause your blood pressure to drop lower than intended, which carries its own risks. Please speak to your GP before taking berberine if you're on any blood pressure medication. There's also a broader interaction concern. Berberine affects liver enzymes, specifically CYP3A4 and CYP2D6, which are responsible for processing a wide range of medicines. This means it could alter the levels of other drugs in your system, including immunosuppressants and anticoagulants. If you take any regular medication, a conversation with your doctor or pharmacist before starting berberine is essential. On the safety side, the most commonly reported side effects are gastrointestinal, things like nausea, bloating, or digestive discomfort. Berberine is contraindicated in pregnancy and breastfeeding and should be used with caution in anyone with liver or kidney disease. Long-term safety data beyond 6 to 12 months is currently limited, so periodic review with a healthcare professional is advisable if you're taking it regularly. If you're considering berberine, here are some things worth discussing with your doctor: whether it's appropriate given your current health conditions, how it might interact with any medicines you're already taking, and how your blood pressure would be monitored if you did decide to try it. And if you experience any unusual symptoms after starting berberine, such as dizziness, significant changes in how you feel, or any signs of an allergic reaction, contact a healthcare professional promptly. So to recap, berberine is a plant-derived supplement with some emerging research behind it, but the evidence is still limited, and UK guidelines don't recommend it for blood pressure management. It has meaningful interaction potential with a range of medications, so always check with your doctor or pharmacist first. And it is never a substitute for prescribed treatment. Have you got questions about berberine, or are you thinking about trying it? Let us know in the comments. If you found this video helpful, give it a like and subscribe to the Bolt Pharmacy channel for more evidence-based health content.